Congresswoman, thank you. Over to Congressman Paul. You're known as the absolutist in the bunch, someone who has consistently opposed federal government from having any role, and I think by your definition that isn't explicitly laid out in the Constitution. So this makes people curious. Is there a line with you? Where do you draw it? Does this include things like making cars safe, making medicine safe, air traffic control, controlling the jets above our heads?
Well, I think in theory, if you understood the free market and a free society, you don't need government to do that. And we live in a society where we have been adapted to this, and you can't just drop it all at once, but you can transition away from it. On regulations, no, I don't believe in any of these federal regulations, but that doesn't mean I don't believe in regulations. The regulation of the marketplace takes care of it. Just think if we had the regulations on the market that dealt with the bankruptcies, that had to go bankrupt. We wouldn't have been able to bail out the big banks and the big corporations and dump on the poor people. Well, so the market would dictate it. You can't commit fraud. If you need detailed regulations, you can do it at the state level, but the federal government is not authorized to nitpick every little transaction. The way they use the interstate commerce clause is outrageous as far as I'm concerned.
Well, 30 seconds more for devil's advocate here, because would you then put it on the drug companies to say, no, we're bringing this to market, trust us, it's a fantastic drug. All the pilots in the sky to add to their responsibilities their own air traffic control in an organic way.
Well, what I said is theoretically it could be privatized, but who ends up doing the regulations on the drugs? They do as much harm as good. They don't take good care of us. Who gets to write the regulations? The bureaucrats write the regulations, but who writes the laws? The lobbyists have control. So the lobbyist from the drug industry has control of writing the regulations, so you turn it over to the bureaucracy, but you would have private institutions that could become credible. And I mean, do we need the federal government to tell us whether we buy a safe car? I say the consumers of America are smart enough to decide what kind of car they can buy and whether it's safe or not, and they don't need federal government hounding them and putting so much regulations on that our car industry has gone overseas.
Congressman, thank you. Over to Speaker Gingrich. Mr. Speaker, as you remember, you wrote the foreword to Rick Perry's most recent book called Fed Up, and you called him, quote, uniquely qualified to explain what's taking place with the economy. Does that mean in terms of job creation credentials he has your proxy at a gathering like this?
No, but it means if he wants to write another book, I'll write another foreword. As he himself, look, he said himself, that was an interesting book of ideas by somebody who's not proposing a manifesto for president. And I think to go back and try to take that apart is silly. But let me just use my time for a second, if I might, Brian. I served during the Reagan campaign with people like Jack Kemp and Art Laffer. We had an idea for job creation. I served as a freshman, or as a sophomore, helping pass the Reagan Jobs Program. At newt.org, I put out last Friday the response to the Obama stagnation. The fact is, if you took the peak of the Reagan unemployment, which he inherited from Carter, by last Friday, going month by month, under Ronald Reagan, we'd have 3,700,000 more Americans working. When I was Speaker, we added 11 million jobs in a bipartisan effort, including welfare reform, the largest capital gain tax cut in history. We balanced the budget for 4 straight years. The fact that President Obama doesn't come to the Reagan Library to try to figure out how to create jobs, doesn't talk to any of these 3 governors to learn how to create jobs, doesn't talk to Herman Cain to learn how to create jobs, tells you that this is a president so committed to class warfare and so committed to bureaucratic socialism that he can't possibly be effective in jobs.
Mr. Speaker, thank you. The questioning continues with John Harris.
Thank you. Thank you, Brian. It didn't take you folks long to mix it up on the question of jobs. I'd like to turn to another subject that's been dominating this campaign. It's health care. Governor Romney, 4 years ago on this same stage, you had this to say about your record in Massachusetts.
Great opportunity for the entire country.
John?
Well, he had a lot more to say than that, didn't he?
Yes, that's right. Okay, I'm sorry, we had a little bit of a glitch right there. But, Governor, you said that it was what you did in Massachusetts was a great opportunity for the country. I'm going to get to you in just a minute. What I'd first like to do is ask if anyone else on this stage agrees that the Massachusetts example was a great opportunity for the rest of the country. No.
No. It was a great opportunity for us as a people to see what will not work, and that is an individual mandate in this country.
Got it. That's actually Governor Romney leads to my question. I've heard you on this many times before. You said some things about the Massachusetts law worked, other things didn't work as well. Let's go to what Governor Perry mentioned, the individual mandate. The government saying that people have to buy health insurance. Was that one of the things that worked in Massachusetts?
Let's step back and make sure I make something very clear from the very outset. I understand health care pretty darn well, having been through what I went through as a governor. And one thing I do on day one if I'm elected president is direct my Secretary of Health and Human Services to put out an executive order granting a waiver from Obamacare to all 50 states. It is bad law. It will not work, and I'll get that done in day one. Now, number two, what we faced in our state is different than what other states faced. What we had is a lot of people who found that they could simply stop getting insurance, go to the hospital, and get free care paid for by other people, paid for by taxpayers. We were spending hundreds of millions of dollars in our state giving care to people who in some cases could afford to take care of themselves. And we said, you know what? You've either got to get insurance if you can afford it, or you're going to have to help pay the cost of providing that care to you. And that was the approach that we took. It's a model that lets other states still take a look at it. Some parts of it have been copied by the states, some haven't. One thing I know, and that is that what President Obama put in place is not going to work. It's massively expensive. In our state, our plan covered 8% of the people, the uninsured. His plan is taking over 100% of the people, and the American people don't like it and should vote it down.
Thank you, Governor. Governor Perry, you clearly don't like the Massachusetts plan as an example for other states, but Massachusetts has nearly universal health insurance. It's first in the country. In Texas, about a quarter of the people don't have health insurance. That's 50 out of 50, dead last. And, sir, it's pretty hard to defend dead last.
Well, I'll tell you what the people of the state of Texas don't want. They don't want a health care plan like what Governor Romney put in place in Massachusetts. What they would like to see is the federal government get out of their business. For Medicaid, for instance. As a matter of fact, I bet Mitt and John would both agree, and I know Newt would as well. Medicaid needs to be block granted back to the states so that we can use the innovation in the states, come up with the best ways to deliver health care. My wife is a nurse, and I'll promise you, we understand that if we can get the federal government out of our business in the states when it comes to health care, we'll come up with ways to deliver more health care to more people cheaper than what the federal government is mandating today with their strings attached. Here's how you do it. One-size-fits-all effort out of Washington, D.C. That's got to stop. And I'll promise you, on day one, as the President of the United States, that executive order will be signed and Obamacare will be wiped out as much as it can be.
Governor, quick follow. Why are so many people in Texas uninsured?
Well, the bottom line is that we would not have that many people uninsured in the state of Texas if you didn't have the federal government. We've had requests in for years at the Health and Human Services agencies to have that type of flexibility, where we could have menus, where we could have co-pays, and the federal government refuses to give us that flexibility. We know for a fact that given that freedom, the states can do a better job of delivering health care, and you see substantially more people, not just in Texas, but all across the country, have access to better health care.
John?
Thank you.
John?
Just 1 minute. I'd like to go to Governor Huntsman, if I could, because at the heart of this is this argument about the individual mandate. Is it ever appropriate for government at any level, federal or state, to force people to buy health insurance?
Absolutely not. You know, at some point, we're going to get around to talking about individual and personal responsibility. I'm raising 7 kids. I've got a couple of them here. The most important thing we can do in this health care debate, right, Rick, is talk about individual responsibility, personal responsibility. But I've got another solution for you with these 2 great governors over there, both of whom I like and admire. And I hate to tell you that the situation in Utah is pretty darn good, but I want to draw you to another example there. We embarked upon health care reform. We did better than Rick in terms of covering the uninsured, and we don't have a mandate. It allows the free market to create a marketplace of choices and options for people. I believe that once Obamacare is repealed, and it will be,
The question will then be, what do we do now? And I'm here to tell you that what we did in Utah is going to be a perfect example of what we do now. We approach cost-cutting, cost overruns, harmonizing medical records, which doctors will tell you is a hugely consequential deal, and expanding the marketplace for choices and options for individuals to choose from without a heavy-handed and expensive mandate that has caused, for the average family in Massachusetts, $2,500 to go up.
Thanks, Governor. Congresswoman Bachmann, let's turn to you. Is Governor Romney's support of an individual mandate in Massachusetts, is that disqualifying from the point of view of conservative voters?
Well, what I want to say is that Obamacare took over 1/6 of the American economy. And with all due respect to the governors, issuing an executive order will not overturn this massive law. This will take a very strong, bold leader in the presidency who will lead that effort. None of us should ever have ourselves think that the repeal bill will just come to our desk. It will take a very strong leader. I was the first member of Congress to introduce the bill to actually repeal Obamacare. As the nominee of the Republican Party, it will be my business to make sure that I elect also 13 more Republican senators who will help me repeal Obamacare. This is the issue of 2012, together with jobs. This is our window of opportunity. If we fail to repeal Obamacare in 2012, it will be with us forever, and it will be socialized medicine. It must be gone now, and as President of the United States, I won't rest until I repeal Obamacare.
Speaker Gingrich, it sounds like we've got a genuine philosophical disagreement. In Massachusetts, a mandate, almost no one uninsured. In Texas, a more limited approach, about a quarter uninsured. Who's got the better end of this argument?
Well, I'm frankly not interested in your effort to get Republicans fighting each other.
Speaker Gingrich, we've got a choice between an individual mandate and not. So anyway, go ahead.
You would like to puff this up into some giant thing. The fact is, every person up here understands Obamacare is a disaster. It is a disaster procedurally. It was rammed through after they lost Teddy Kennedy's seat in Massachusetts. It was written badly. It was never reconciled. It can't be implemented. It is killing this economy. And if this president had any concern for working Americans, he'd walk in Thursday night and ask us to repeal it because it's a monstrosity.
Amen.
Every person up here agrees with that.
Right. Yep.
And let me just say, since I still have a little time left, let me just say, I, for one, and I hope all of my friends up here, are going to repudiate every effort of the news media to get Republicans to fight each other to protect Barack Obama, who deserves to be defeated, and all of us are committed as a team. Whoever the nominee is, we are all for defeating Barack Obama.
Mr. Payne, Mr. Payne, I'd like you to get in this, but my understanding of why conservatives don't like the Obama plan, the individual mandate, is at the heart of it. So this is a genuine philosophical disagreement that I'd like your view on. Is the individual mandate ever justified at the state level or the federal level?
No. An individual mandate to buy something is not constitutional. Now, back in the early 1990s, I worked with Speaker Gingrich to fight Hillary Care. I have been outspoken fighting Obamacare, which needs to be repealed. Now I'm running against Romney Care. Neither one of them works. Here's what I would do. Let's pass patient-centered, market-driven reforms. Loser pay laws. Some people call it tort reform. Loser pay laws. Let's expand medical savings accounts versus what the president did in Obamacare. He shrunk health savings accounts. Let's allow association health plans. When I ran the National Restaurant Association, today it has 14 million people. We wanted to put together a plan that would be tailored to the constituency of that industry. We could not do it. We would have been able to do it cheaper and cover more people if we didn't have the restrictions that are out there today that are preventing the free market from bringing down costs and increasing access.
Mr. Kaine, thank you. Senator Santorum, On another front, you're a devout Catholic. You've always said that you will not place it aside in your role in elected public life. In fact, you thought President Kennedy, the first to be elected president, did so a little bit too much with his own religion. Having said that, the Catholic faith has, as a part of it, caring for the poor. 1 in 7 people in this country now qualifies as poor. Where do the poor come in? Where do they place in this party, on this stage, in a Santorum administration?